Okay, and time checks about 2:29. Saying hello to everyone. Welcome down, ladies and gentlemen. Now, don't forget to mute your microphone. And of course, this is another session brought to you by the Singapore Heart Foundation and our second series. All right, and today's talk is all about hypertension and your heart and so forth. But we're going to be showing you some videos. So let's hopefully you guys are all here joining us. This is a very special video. So let's all stand by for the video. And here's more information about this video. Coming up next will be Novartis Invisible Nation. Now, Invisible Nation is a Novartis multi-year program co-created with Global Heart Hub and powered by patient organizations around the world. Now, designed to ignite conversation, inspire action, and activate systemic change about unmanaged atherosclerotic cardiovascular disease, or ASCVD, a major driver of heart attacks, strokes, and death around the world. And for more details, you can also refer to the chat box for the link. So ladies and gentlemen, let's stand by to watch this amazing video from our sponsor, Novartis. Can you see us? Made Invisible Nation. Enjoy the video.
Can you see us? We are your family, friends, and neighbors.
Living with ASCVD, atherosclerotic cardiovascular disease.
ASCVD is the underlying cause of 85% of heart attack and stroke-related deaths.
This is a disease that threatens all nations and races.
It's real, it's widespread, and despite the alarming numbers, ASCVD isn't widely known.
And too often, it's overlooked.
Every one of us is a statistic, accounted for, but largely unseen.
Most of us are unaware of our risk, or indeed the consequences of ASCVD.
We are
an invisible nation.
It's time to change the course of ASCVD.
To make the unseen seen.
To work together to reduce heart attack, strokes,
and lives lost.
To help the world see that reducing the impact of ASCVD
lifts every nation. Help us to be seen. Share this video and visit invisiblenation.com.
Well, there you go, ladies and gentlemen. We hope you enjoyed this wonderful video. And we're about to start. So just once again, a gentle reminder to switch your microphone to the mute, and we can begin right now. Well, once again, good, wonderful afternoon to all our wonderful viewers. Thank you for joining us again for our second segment, our second session. And let me tell you a bit more about the May Blood Pressure Measurement Month, or MMM. Now, ladies and gentlemen, MMM is an international campaign initiated by the International Society of Hypertension, and let me just get the screen right, and also to raise awareness about high blood pressure. Now, SHF is supporting this campaign and would like to invite you to be part of the initiative. As part of the campaign, the International Society of Hypertension is conducting a global survey to highlight the importance of BP checks, better understanding the impact of high BP on different communities, and to improve healthcare for BP worldwide. Now, at the end of the session, we will share how you can be part of the campaign. And today's topic is high blood pressure. Now, high blood pressure is often called the silent killer, as it does not present any signs and symptoms until a serious complications such as heart attack, heart failure, and stroke happens. The best way to protect yourself are regular screening and making lifestyle changes that matter. And today, our cardiologist, Dr. Lau, will be telling me more about this very, very important topic. And of course, we will try to answer as many questions as we can about high blood pressure. And if you have any questions for Dr. Lau, please leave your comments in the Q&A box. And any unaddressed questions, due to the interest of time, SHF will be replying directly to you via email. So we hope that works for you. So right now, ladies and gentlemen, it's time to welcome our speaker, Dr. Lau Lip Ping, Chairman Emeritus, Singapore Heart Foundation, and consultant cardiologist from the Mount Elizabeth Medical Center. So let's welcome Dr. Lau. Over to you, Dr. Lau.
Thank you. Can you all hear me? Can you hear me?
Loud and clear, sir.
Okay, that's good. So welcome back, especially those who were with us last week. I'm really happy that you are here to go on to the next chapter of this discussion. And this is called Heart to Heart. This is episode 2. It's about managing heart health risks. And this is just to remind you that last week I started discussing what is atherosclerosis because I wanted to answer the question, what is cardiovascular disease? And I said that the most important type of cardiovascular disease is this disease, atherosclerosis. And I'll show you again this picture of a cross-section of an artery, and you will remember that I said atherosclerosis starts with the development of what is called an atheroma, a collection of cholesterol and other lipid substances, and then there's a fibrous cap that goes to line this atheroma, and sometimes this atheroma thins out, may rupture. It may then cause a blood clot to form, and then that's the beginning of either a heart attack or a stroke. And we went through various risk factors, and I mentioned then last week that some of these risk factors are not modifiable, some are modifiable related to lifestyle, and some are medically treatable risk factors. So as I was saying just now, we last week we discussed cardiovascular disease, atherosclerosis, and we discussed some of the risk factors associated with atherosclerosis. And you will remember that we went through non-modifiable risk factors where I spoke about factors which are related to things like your genetics, your gender, your age. And then I spoke about those risk factors which are related to lifestyle, like smoking, obesity, dietary factors, lack of exercise. And we finally ended up with medically treatable factors, and I spoke about cholesterol and triglycerides. And I said, wait until next week, akan datang. We will then discuss inflammation, diabetes, and finally the topic that we really want to discuss this week, and that is high blood pressure. So medically treatable risk factors, we've discussed already. I'm going to talk to you now about inflammation. And what we know about inflammation is this, as shown in this slide. There are quite a number of studies in the last 10, 20 years that shows that in actual fact, infection does contribute to development of atherosclerosis and to the acute complications of atherosclerosis. On the left part of this slide, you will see some very complicated discussion of how pathogens which are infectious viruses or bacteria can cause the development of what we call plaques and eventually contribute to atherosclerosis. But this is a very scientific, abstruse matter, so I don't want to complicate things at this point. This is another similar slide. It's more pictorial here. And again, the authors of this paper mentioned that inflammation is fundamentally protective response of the body against any offending agent or tissue damage. And it involves responses of vascular tissues and white cells which get rid of the primary cause of the insult, that means the bacteria or virus. But in the process of doing this, then there's an inflammatory response, and inflammation in the blood vessels can also contribute to atherosclerosis. And I'm showing this slide because this is very interesting. This was a study performed in the US, I think some 15, 20 years ago. And what they did was they took 286,000 people over this age of 65 years. And what they did was they divided them into two, and in 77,000 people, they gave them vaccination with influenza vaccine. Another 60,000 were not vaccinated. And what they found was that after they followed them up for up to about 2 years, that those who were vaccinated had less hospitalization for coronary heart disease, for heart failure, for death due to cardiovascular disease, and also for the total of hospitalization for death due to cardiovascular disease and for complications of cardiovascular disease. So I think in the midst of, at the moment, COVID infection epidemic, you want to make sure you get vaccinated against COVID, because that could possibly contribute to atherosclerosis. Certainly, you should get yourself vaccinated against influenza. And influenza vaccination, as you know, is administered once or twice a year, depending on whether the virus mutated. So remember, get yourself vaccinated whenever it's offered to you. Okay, what I'm going to do now is to talk about diabetes. And this is a study to show that one of the most common non-communicable disease characterized by abnormally high blood levels of, in this study, it was found to be the fourth or leading cause of death in most developed countries. And more than 177 million people have diabetes worldwide. And we know that the incidence of diabetes is increasing. It's estimated to rise to 300 million in a few years' time, and expected to increase or treble in Africa, the Mediterranean country, Middle East, Southeast Asia, double in Americas, and almost double in Europe. So a very important disease that is also contributing to atherosclerosis. Now, to diagnose diabetes, you need to check your blood, and these are some of the criteria for diabetes: either fasting blood glucose over 126 milligrams per deciliter, or you can check your blood 2 hours after taking a dose of glucose. And if you are more than 200 milligrams per deciliter, that's another indication that you might have diabetes. Another test that is commonly done in clinics is to measure what we call HbA1c. This is measuring the hemoglobin molecule that has got glucose attached to it. And if more than 6.5% of it, if there is a value of 6.5% or more, then you might have diabetes. Or if you, at random, non-fasting, measure your blood glucose is more than 200 milligrams per deciliter, then you may also have diabetes. Now, in the recent National Population Health Survey, it was found that approximately about 10.6% of males have diabetes and 8.4% of females have diabetes. And you can see that diabetes increases as one gets older, so that by the time that you are in your 70s, about 1/4 of all individuals may have diabetes. So go and get yourself checked to see whether your blood glucose is elevated, because blood glucose is an important risk factor also for atherosclerosis. And this is to show you some of the things that might happen if you have diabetes. We know that diabetic patients have a 2 to 6 times higher risk of development of things like coronary heart disease, stroke, and disease of the blood vessels of the lower limbs. Diabetics also have more risk for kidney failure, also for damage to the retina of the eyes, and for damage to the nerves of the lower limbs, so that you get numbness and weakness of your lower limbs. So we finally come to what we want to discuss, and that is high blood pressure. We call it the silent killer. And what you want to do is, if you have high blood pressure, we want you to get it down. This is data from the Singapore National Population Survey, again, recent study in 2019 to 2020. And you can see that if you look at the prevalence of hypertension amongst Singaporeans, if you are over the age of 70 to 74, about 74% of men and 75% of women actually have some degree of hypertension. So that's a very important fact. So do check your blood pressure to see whether you have hypertension. So we now ask ourselves, what is high blood pressure or hypertension? And we need to start off by asking ourselves, what is blood pressure? What is this thing that is high? Why does it cause the damage to your body? How do you find out you have high blood pressure? How do you prevent high blood pressure? And how do you treat high blood pressure? So we again go back to this basic diagram of the artery. And if you were to do a cross-section, cut across it, you can see that this is the lumen, or the inside of the blood vessel or artery. That's the wall of the artery. And when the heart pumps blood, blood is ejected into the artery, and there's a force against the wall of the blood vessel. And that is the upper reading of the blood pressure, what we call systolic blood pressure. And systolic blood pressure, if you were to measure it, there will be a figure like, for example, 120 or so. And then the blood vessel will relax. When the heart is relaxed, the pressure comes down, and then you get a lower reading, and that's called diastolic blood pressure. And it may be, for example, 80 or so. So high blood pressure is therefore also known medically as hypertension, and blood pressure varies constantly depending on the time of day, what you are doing. When you are physically active or when you are very excited, then your blood pressure may increase. And when your blood pressure is above what we consider the healthy range, then we say you have high blood pressure or hypertension. Now, most people can't tell whether their blood pressure is high, and that is why hypertension is sometimes referred to as the silent killer. So why does blood pressure increase in some people? Blood pressure increases when blood vessels become less elastic. And this is more likely to occur with age, but it also occurs when certain factors are present. Now, when high blood pressure is present, the heart has to work harder to pump the blood through the blood vessels because of the greater resistance of the blood vessels. And this causes the pressure inside the chamber of the heart also to increase. And this may lead to enlargement of the chamber, or to thickening of the heart muscle, or to both. Now, we say that there are two types of hypertension. More than 90% of hypertension is primary, sometimes referred to as essential. That's a very old term. Nowadays, we like to discard this term because it suggests that it is essential for your blood pressure to increase. Primary hypertension is said to be present when there is no identifiable cause of high blood pressure, and it is the type of high blood pressure that more than 90% of people with high blood pressure have. And it tends to develop gradually over many years. As I said, as you get older, then you have a greater chance of developing high blood pressure. And then we have what is called secondary hypertension. And this is caused by some underlying condition. This is present in less than 10% of people with hypertension. It may occur in some people who have a condition we call obstructive sleep apnea. This particularly in people who are overweight. When they are asleep, they get some obstruction of the upper respiratory tract, snore a lot, then they stop breathing every now and then, oxygen level drops and the blood pressure tends to increase. And then commonly kidney disease, people with chronic kidney disease may also have hypertension. And then there are certain glands like the adrenal glands or the thyroid gland, which also, if they are overactive, may cause high blood pressure. And then there are certain defects in which the blood vessel becomes constricted from the time a child is born. There is a condition called coarctation, and that may cause hypertension. And then there are certain medications, for example, birth control pills, certain cold remedies, decongestants, and then over-the-counter analgesics or pain relievers, which may also cause the blood pressure to increase. This is one of the consequences of high blood pressure. It's called left ventricular hypertrophy. This is because when the heart has to work against a higher blood pressure, then the muscle of the left heart chamber can thicken. That's a condition called left ventricular hypertrophy. And one of the common causes is high blood pressure. And if it's left untreated, eventually the muscle may weaken. Not only does it hypertrophy, it weakens, and then you may get heart failure due to hypertension. Now, high blood pressure is also a very common cause of atherosclerosis, which is what we started to discuss last week. And to again emphasize that high blood pressure causes atherosclerosis because the blood pressure against the wall of the artery, when it's increased, causes a reaction that gives rise to atherosclerosis. And so because of atherosclerosis, we have many important complications of hypertension. In the case of the brain, you may get bleeding or blockage of the arteries to cause a stroke. In the case of the heart, you get enlargement of the heart. You may also get heart failure. In the case of the blood vessels of the eyes, you may get damage to the retina at the back of the eye. And in the case of the blood vessels of the legs, you may get narrowing. And in the case of the kidneys, you may get protein excreted, and that extra protein excreted sometimes can cause kidney damage and eventually kidney failure. Now, we know that lowering blood pressure is associated with very significant reduction in the risk of cardiovascular events. And this is one such study some years ago, a study that looked at a combination of 61 very big studies, involved 1 million adults, and the follow-up averaged 12.7 million person years. And they found that just a decrease in 2 millimeters of the upper reading systolic blood pressure will give rise to 7% reduction in risk of death due to coronary heart disease and other diseases of the blood vessels, and a 10% reduction in the risk of death due to stroke. So reducing blood pressure is a very effective way of reducing your risk due to cardiovascular disease. Now, how do you know whether you have high blood pressure? Simple. You cannot feel high blood pressure, so you can measure it with a blood pressure meter. And this is, nowadays, they are very convenient. They come in these portable devices with a cuff. Okay, then how often should you measure your blood pressure? If your blood pressure is normal the first time you measure it, less than 130/80, you can then measure it every 1 or 2 years. High normal, then you should measure it at least yearly. High normal would be if the upper reading is 130 up to 139, lower reading is 85/89. But if it's 140/90 or less when you measure it on your own, then you should be measuring more frequently, perhaps once every month or 2 months, to make sure that it does not keep on increasing. And if it does, then you ought to see your doctor to check on what you can do about it. So who can check your blood pressure? The most important person, of course, is yourself. If you're in the clinic, the nurse can measure it, or the doctor or other healthcare providers. And you can even ask pharmacists. Nowadays, pharmacists are very helpful, and they can measure your blood pressure for you. If you go and pick up some medication, ask them whether they have a blood pressure set, and they may be able to measure it for you as well. Now, how do you choose a suitable blood pressure monitor? If you decide to measure your blood pressure at home, you will need to get one of these monitors. And there is a very wide range of home blood pressure monitors, but it is important to be sure that that monitor you choose is accurate and the right one for you. The technical name for a blood pressure monitor is a sphygmomanometer. Sphygmomanometer. Okay. So this is an example of an automatic blood pressure monitor. There are many different types, but it is easier to use one that is automatic. Some of the other older meters still use a Mercury column, but those are becoming less and less frequent, and I'll tell you why in a moment. You should choose one that measures your blood pressure at your upper arm rather than your wrist or finger. I know that there are people who get these small portable devices and then they measure it from the wrist. It's been shown that measurement at the wrist is not quite as accurate, sometimes may give you an exaggerated reading. So upper arm blood pressure monitors are the ones most accurate and can give you the most consistent results. Now, you want to make sure that you have the right cuff size, and one of the ways in which you can decide on the right cuff size is to measure your upper arm. And if you have a small arm, then the cuff size can be small, or medium size, 22 to 32 centimeters, medium cuff size. And if you have arm size more than 32, then you want to use one that is a big cuff size. And you should choose one that suits your budget. You need not get one of those with a lot of for gadgets, because actually a lot of those devices which have got gadgets where they have a computer program that records your blood pressure, totes it up over weeks or months, gives an average reading. Useful sometimes if you have hypertension and you are following up on the response to treatment. But for most people, a simple one that gives you an accurate reading is what you want. Okay, now some people ask, what about the Mercury sphygmomanometer? Actually, the Mercury sphygmomanometer is still regarded as the so-called gold standard, maybe we should say Mercury standard for blood pressure measurement. And this is a picture of one such devices. They're becoming vintage now. So if you have one, maybe it will increase in value as the years go by. And of course, you need also a stethoscope. Okay, A word about mercury sphygmomanometers. Because mercury is a potential hazard as they can cause neurotoxicity when ingested. So World Health Organization in the year 2011 recommended that mercury containing devices like sphygmomanometers and thermometers should be progressively phased out. One of the problems, however, in getting rid of mercury devices is that they can contaminate the environment. So you got to find a safe way of discarding your mercury devices if you want to throw them away. Better find out from somebody who knows how you dispose of mercury. Otherwise, you will go into the sea, you will be engulfed by fish, and then if you should happen to buy fish that has engulfed the mercury, you may get poisoned. Okay, what about the do's of blood pressure monitoring? First, I think you want to carefully read the instructions on your blood pressure monitor. One, the important thing is go to the bathroom, empty your bladder before taking your pressure, because a full bladder can cause your blood pressure to be artificially increased. You should sit comfortably with your feet flat on the ground, your back supported, your arm at heart level. A bare arm is the preferred method, or if you need to still wear your shirt, make sure that your shirt sleeve is very thin. And then you should put the cuff on and then wait for 5-10 minutes. Don't measure it immediately, because immediately blood pressure may not have quite settled yet. Then take at least 2 readings, preferably 3. Wait for 1 to 2 minutes between the readings, and usually it is the lower reading that is more indicative of what your blood pressure is. And then record the date and time of your measurement, and you can show the readings to your doctor or to your nurse when you next go and visit your doctor or your nurse. Okay, a few words about what you shouldn't do. Don't cross your legs when you take your blood pressure, because it's been shown that crossing your legs can increase your pressure. Don't take your blood pressure if you're in a hurry, you're waiting to go somewhere, then measure it at the last moment, because you are going to have an increase in your blood pressure. Don't smoke for at least 30 minutes before measuring, and don't drink coffee again for 30 minutes before measuring. Don't eat a big meal for 2 hours before measuring. Again, don't wear tight clothing, because that may cause your blood pressure to be high. And again, do not talk or watch TV during a measurement. I sometimes have patients come to the clinic while I'm measuring their blood pressure. They insist on talking to me about various things. And quite often I have to tell them, please, can you stop talking for a little while? And don't measure your blood pressure if you're cold or nervous or uncomfortable or pain, or when you're giving a lecture as now, because I know my blood pressure at the moment is increased. So what should your blood pressure be? Well, for most people, including those with kidney disease, if you're in the clinic, it should be less than 140/90 when the doctor or nurse takes your blood pressure. If you are aged 80 years or more, you are allowed to have a slightly higher blood pressure of 150/90. And then if you have diabetes, it's been shown that diabetics don't tolerate blood pressure very well. So if you have diabetes, you want to make sure that in your clinic, you have a blood pressure of 130/80. And if your doctor measures it more than 130/80, it's likely that he will tell you, I think we had better adjust your high blood pressure pill to get your blood pressure down. So a blood pressure consistently greater than or equal to 135/85 in the clinic is likely to be considered to be a bit high. Now, a blood pressure in the office offers only a snapshot of a whole day's blood pressure. And we know that there are some people in whom the blood pressure can be going up and down throughout the day. So a useful way of knowing what the blood pressure pattern is like during your day is to do what is called ambulatory blood pressure. This is a non-invasive automated procedure, often recorded over 24 hours. And these devices are capable of making automated measurements at predetermined intervals. You can set it so that it records the blood pressure every 15 minutes or half an hour and so on. And you see here the blood pressure curve together with a device that is now kept at the belt there. And we know that blood pressure has what we call a 24-hour circadian pattern. We know that in the morning, your blood pressure is a bit higher than in the evening. In the evening, blood pressure tends to come down. When you go to sleep, there is a 10 to 15% drop in blood pressure, and we call that the nocturnal dip. And then about 1 or 2 hours before you get up, your blood pressure begins to come up. And the moment you wake up, there is what is called an early morning blood pressure surge. So it's useful to know that if you record your blood pressure in the evening, it should be lower than it is when you record it in the morning. So when should you think should have an ambulatory blood pressure measurement done? Well, when you suspect that you may have a condition called white coat hypertension. White coat hypertension is when you're in the clinic, blood pressure is high. When you're at home or outside the clinic, it is normal. Or the reverse. There are some people who go to the clinic, blood pressure is normal, but when they go out of the clinic, blood pressure increases. That's called masked hypertension. And then there are people whose blood pressure goes up and down, episodic, useful to do an ambulatory blood pressure. And then there are people who are taking medications and the blood pressure is frequently high. You want to know, is it really resistance to medication, or is it because the patient is just in the clinic? And then also sometimes useful to know if a patient has symptoms, is it related to taking high blood pressure medicines? And then there are people who have abnormal nervous system function in whom it is good to know what the blood pressure pattern is like. So what is white coat hypertension? This is a situation where the blood pressure value is higher than normal when measured in a medical environment in the clinic. But on the other hand, the average daytime ambulatory blood pressure is actually normal. So this is a recording I took in my clinic one day with a patient, and we found out that the 24-hour blood pressure was normal. But when the patient came to my clinic, it was very high. It went up to 180. For some reason, when the patient saw me, somehow I had an effect on the patient and his blood pressure would increase. And we call that white coat hypertension. And a 24-hour blood pressure recording is actually, in fact, a useful way of knowing whether the patient has white coat hypertension. So what if you have high blood pressure? What can you do? Okay, these are some of the things you can do apart from taking medication. And you can lower your blood pressure if you remember the word pressure. Get regular physical activity, make sure you're moving, reduce your weight if you are overweight, eat a healthy diet. If you're a smoker, stop smoking, eat less sodium, that is salt, and you can control your blood pressure by taking your medication. And you can also avoid, excessive salt in your diet. And I've taken this from a Heart Foundation website. It says you can lower your blood pressure with regular physical activity, by eating healthily, salt less than 5 grams, by stopping smoking. And why do you consume less salt? Well, the Health Promotion Board says that you should stick to a limit of 200 milligrams of sodium per day, which is equivalent to 5 grams of salt, because excessive salt does contribute to high blood pressure. And we know that treatment can help controlling your blood pressure. May require you to make healthy lifestyle choices. Why do you treat hypertension? Because treating hypertension reduces heart failure by 50%, stroke by 38%, heart attack by 15%, and death by 15%. So down with high blood pressure, the silent killer. And this is the end of my presentation. And maybe in future, next change, we can speak about how do you get your blood pressure to go lower. And maybe if you're interested, we can discuss something about cholesterol facts and myths. But that's up to you. Maybe in your feedback, you can tell us whether you would also like to learn something about these other topics. That's it.
Well, thank you very much, Dr. Lau. That was a very, very short but very, very detailed presentation. We have a viewer, Joy. She's asking whether if you can show again the don'ts of taking the measurement for high blood pressure, what you should do. Yes, what you should not do before you take your. That's a very interesting slide that I saw earlier as well. So let's share this slide once again so everybody can capture. Now, guys, you can take out your mobile phone, and if you want to take some specific slides, go ahead. I think this is a very important slide because most people tend to do these things before they take their readings, and then they're so surprised why it's so high. So let's take a look at the slide. And if you have a camera, there you go. So please just take a snapshot. This is for Joy Tan and everybody else. Take a look at the snapshot. We're going to give you 30 seconds to take a photo, and then we'll go.
Another one with a hold on a moment. These are the do's. If you want to, you can take a snapshot of this do again before I show you the don'ts.
Okay, hurry guys, take your mobile phone if you can, or at least a snapshot or print screen. You can print screen button on your laptop. All right, function print screen, or just press print screen and then paste it onto a Word program, and then you can have that particular picture. So in a short while, we're going to be showing the don'ts of taking the blood pressure.
We are planning to also to upload this presentation on the Heart Foundation website in future. So in future, you can log on to the Heart Foundation website, and you might find that this set of slides will also be there. So don't panic if you are not able to take a snapshot of this.
And also there are many other videos as well on the on YouTube as well, or the Singapore Heart Foundation website, where you can find out more about previous topics on high blood pressure, diabetes, and so forth. Okay, so with that, I'd like to move on to a quick summary before we begin our Q&A. We do have some questions already, but please continue to post the questions. We'll try best to answer them. So a quick recap, guys. Flu vaccine does reduces cardiovascular disease based on the facts given, and diabetes also increases as we age. That's pretty natural. Now, most people can't tell if they have high blood pressure. Best way is to measure them regularly if you fall within the high risk category. There are two types of hypertension. We have primary, which is natural as we age, and secondary is underlying condition. They can be like sleep apnea, kidney disease. Certain drugs and medications can also cause high blood pressure to increase. High BP causes atherosclerosis, which is in layman's term, hardening of the arteries. All right, and measure your BP at the upper arm as it gives you better reading. Full-blooded may give you a high reading as well, so please relieve yourself and avoid high salt, fried foods, and of course alcohol and smoking, and do exercise regularly. And these are some of the tips that I've picked up along the way. So right now, let's move on to the Q&A. So first Q&A question I have is coming from this particular person. And this will be Freda. Now, she said, I was told sleep apnea affects our blood pressure. I rented the CPAP machine for 3 months and nightly reading read 0.2 to 0.4. Now, I did not feel well, slept, and I also monitor my blood pressure, which shows little improvement. I'm unwilling to purchase the machine. Can perhaps Dr. Lau give some tips on how can I move forward?
Well, okay. So first of all, you need to speak to the doctor who diagnosed or picked up your sleep apnea, because there are sometimes contributory factors to sleep apnea, one of which is overweight. So some people who are overweight tend to get sleep apnea, and sleep apnea in turn contributes to an increase in the blood pressure. So if overweight is a contributory factor, then losing weight may help with sleep apnea. If it is not, and is due to sometimes abnormalities in the throat, then you need to discuss with an ENT doctor as to how do you treat sometimes these abnormalities in your throat, in what we call your upper respiratory passages. Some people have these very thickened tissue in the throat, and you may need the ENT specialist to tell you how do you treat that. In the absence of some of these correctable factors, then you may really have no choice but to use a CPAP machine to try and get better sleep, so that your oxygen saturation does not drop during sleep, because one of the contributory factors to high blood pressure because of sleep apnea is because of the drop in the level of the oxygen.
All right, next question coming from Joy Tan. Is eating raw garlic good, as it can, does it help to reduce high blood pressure?
Yes, this is one of those claims that have been made over the years. There is really no very good scientific information that eating garlic regularly helps to control your blood pressure, at least not effectively. So you cannot just take garlic to treat your high blood pressure. If it is increased, you got to make sure that you are taking the appropriate anti-high blood pressure medication. You know also that garlic, every batch of garlic differs in the amount of the chemical constituents in garlic. Yes, some years ago, there was some studies suggesting that there may be a little bit of blood pressure, but I don't think it's significant enough and not all the time effective.
Okay, next question coming from Ng Chui Eng, who has white coat hypertension. Now he's asking what are the ways that he can reduce this fear, all right, of white coat hypertension and bring down his heart BP.
Okay, I think white coat hypertension is due to the fact that some people in any situation, whether it's a clinic or in a situation where they are anxious, the blood pressure is increased. One of the things we sometimes do is to teach people who do get white coat hypertension, who do get tense, nervous in situation, what we call relaxation therapy. Relaxation therapy consists of focusing on each part of your body deliberately, for example, tensing your fists, your forearms, your arms, and then going down to the legs. And after you tense them, deliberately relax, and in actual fact, focusing on the relaxation. And in some people, when you do that, then you get much less reaction to situations where you may be nervous, and that in turn may help you to reduce the excessive rise in blood pressure. But I think people who have got this kind of reaction, it would be useful to do a 24-hour blood pressure recording to see how often your blood pressure is increased, and such persons may still benefit from some treatment with antihypertensive medication. Yes.
Thank you for that. Question from Kok Hua Chan. When is the best time to take blood pressure for health monitoring? Is it daytime or nighttime?
The better time to record your blood pressure is in the morning. As I mentioned, the best time is when you get up. Make sure your bladder is empty. Make sure you haven't taken too much coffee, preferably not taken any coffee yet. And then to take at least 2 readings, preferably 3 if you have the time. Quite often you'll find that first reading is a little bit high. Then you look at the second, third reading, and the lowest of that reading in the morning would be a useful indication of your blood pressure, because as I say, blood pressure in most people is highest during the day. You get a drop of 10 to 15% in most people when you go to sleep. Then in the morning when you get up, there is a temporary rise in blood pressure. We call the early morning blood pressure surge. So wait for the surge to settle down, and it takes 10-15 minutes, then measure your blood pressure. So that's the best time to measure your blood pressure.
Thank you. Very good. Now, this next question coming from Narayanan. It's a 2-part question. First question is, why do our blood vessels lose their elasticity? And next question is, when blood pressure suddenly shoots up, I heard people say that I should take extra dose of BP medication. Is this normal, advisable? What's your take on this?
Okay, first, the part about heart vessels thicken. It's most of the thickening is in actual fact due to the process of atherosclerosis, and I think I already enlarged on the process of atherosclerosis. Is due to the fact that the wall of your arteries and the blood pressure is high. The wall of the blood vessel, first of all, the lining, what we call the endothelium, tends to thicken. Then the muscle which forms the middle part of the blood vessel wall tends to increase, in part because of atherosclerosis. But as I mentioned also, when the heart has to work against higher pressure, one of the things that happens is the muscle gets thickened because it's working against a higher pressure. It needs to generate a higher pressure in order to eject the blood out of the heart. And that gives rise to thickening of the muscle of the heart. So 2 types of thickening of the muscle of the heart and thickening of the wall of the blood vessels.
All right, so we can only take the last 2 questions here. Now, don't worry, guys. If we didn't answer your question in time, we'll reply it via email directly to you. Okay, so no worries. I'm sure that you have many, many more questions to ask. But let's go down to our last 2 questions before we continue. Now, does drastically reducing salt intake leads to extremely low BP, something like 112/51? That means too much salt can bring in too low BP. Is it true?
It can reduce blood pressure, but it's very variable. If you have high blood pressure, reducing salt even drastically will get it usually down just to normal pressures. But it is true that some people who reduce the salt excessively can have a condition we call hyponatremia, where the level of sodium, of course, is one of the components of salt. Salt is sodium chloride, and sodium, when it drops, can cause certain symptoms. It can cause in some people some mental confusion, and some people can feel out of sorts when the sodium level is low. So yes, reducing sodium excessively may contribute to this condition called hyponatremia. But I have yet to come across anybody who is able to tolerate a diet which is so low that the sodium decreases. Usually it's because of the use of diuretics. Certain diuretics or water pills that make you pass out more urine may also cause you to lose sodium. And that's the commonest situation where your sodium becomes very low. Yes.
Thank you. Now we go for the final question. This is a very serious question. Now coming from Lim saying, hey, now if a person went through coronary angiography, but it failed, what is the next procedure or remedial action that we can follow, and is it effective?
Okay, this is not actually part of our discussion about high blood pressure, but yes, I will take that question because it is quite a common situation. Okay, I think what the questioner means is if I went through coronary angioplasty, not coronary angiography. Coronary angiography is the diagnostic procedure in which you inject dye or contrast into the coronary arteries to take a picture. Maybe what you mean is coronary angioplasty, where you insert a special tube or catheter into a narrow artery, and then you blow up, you inflate the balloon, and you try and open up the narrow artery. And sometimes following that, you insert what is called a stent. A stent is like a little capsule which is stretchable by blowing it up, by dilating it using an inflatable balloon. Now, if that fails, and sometimes you may need to, first of all, undergo a repeat coronary angiogram, the diagnostic procedure to determine how much residual narrowing there is. And in some persons where there is still a lot of residual narrowing, then you might either have to undergo further angioplasty, or you may in fact have to see the cardiac surgeon to do a bypass operation. Yes.
Well, thank you very much, Dr. Lau, with all the answers as well. Now, don't worry, once again, we'll reply to you via email. Now, once again, thank you, Dr. Lau, and our sponsors, Novartis, as well as our viewers for joining us today. And we hope you have learned more about managing your heart health risk and hypertension. Now, before we end the session, we'd like to share the MMM, once again, the MMM Global Research with you. And as mentioned at the start of this session, the International Society of Hypertension is conducting a global survey on high blood pressure. Now, we're giving away 15 prizes to participants. Now, to enter, all you have to do is to measure your BP readings 3 times using a BP monitor and take photos of the 3 readings. Now, the BP measurements should be taken on the same day, each reading 2 to 3 minutes apart, not 3 times a day, but at the same moment, at that moment, 2 to 3 minutes apart. And we're going to be flashing you the questionnaire, and we hope you guys will join us as well for this survey. Now you can fill in the questionnaire and upload your photos on this page. Now, upon submission, you will enter the draw and stand a chance to win a wrist BP monitor worth $219 and XR Spark Plus wearables worth $70. Or you can also walk away with the supermarket vouchers worth $30, and there are 5 sets each to be won. We are flashing to you. We're probably putting down the site as well, where you can actually click on the link. And once the webinar ends, attendees will be directed to a survey form page. Now click on Continue tab to participate in our short survey. Now we appreciate if you could take some time to share your thoughts on today's talk by completing the survey form. And with that, ladies and gentlemen, it's my pleasure to have all of you with us right here. And we we want to wish you a wonderful afternoon, and we hope you have learned more about your heart health and hypertension through the two-part series talk here, and are empowered to make better lifestyle choices. So with that, let's say goodbye to Dr. Lau. Thank you to our sponsor, Novartis. Thank you, ladies and gentlemen, to all of you. My name is Samson Z. Stay healthy and see you again next time. Goodbye, one and all.
Right.
Thank you, everyone.
Yes.